would like to call to order today's joint hearing on the Select Committees on Mental and Behavioral Health and the Assembly Select Committee on Justice Reinvestment. What brings us here today? Quite simply, it was an event of a very serious and troubling nature that occurred less than 1 mile from where we convene today. The July 1st beating of a woman who may have been suffering from a mental health episode or crisis, and a series of events that led her to have a violent interaction with a California highway patrolman alongside the Interstate 10 freeway. The shocking events in question were partially captured on a smartphone video by a passing motorist. While that incident served as a catalyst to bring us here today, we have an ancillary purpose for this joint hearing. That purpose is to examine the entirety of the systems and structures in place within California to find the point where levels of law enforcement, persons with mental illnesses, and providers of mental health services intersect.
What I'm hoping today is, yes, we do want to hear about what is the problem with the mental health in the state, but more important, we want to hear some solutions because we have a great opportunity next year to look at ways that we can rebuild our mental health institutions, and rebuild our whole mental health community so that we can handle this problem in a more effective way. And so I'm hoping that you give us some ideas that we can take back to Sacramento, that we can ultimately fund, that we ultimately get back to the communities, and then you can do God's work, which is helping the mental health people in our state of California.
I am so proud that Mr. Ridley Thomas has decided to take this on as his select committee. Mr. Jones Sawyer has been doing this work, as well as Bonnie Lowenthal, and I am a member of the Justice Reinvestment Committee. So as we do this together, we are going to come back, after listening to you, we're going to come back and have something that's going to benefit people in the state of California.
I'm here to listen to the speakers. As a former mental health provider myself, I've had a very strong and long interest in the challenges of public safety and mental illness. We've dealt with this in Long Beach, in Los Angeles, obviously, and I'm here to listen to the speakers give us information about best practices and funding so that we can better serve the people with mental illness.
We're dealing with the issue the best that we possibly can. We are in the midst of an investigation where we are seeking the truth and we're seeking resolution, and that has been our commitment from day one. It is our commitment, and I do appreciate the communities and the membership's trust and patience in a very difficult and a very explosive situation. And so as we move forward, we look for a resolution that will be coming, but I did want to start my comments by acknowledging the fact that we know very well why we're here, and I think it was a great opportunity for us to talk and comment a little bit about where we are in that process. We have developed contemporary training programs, crisis intervention training programs that we've had, but we knew as an organization we wanted to put together the crisis intervention training to deal with this issue at hand. And I'm happy to say that we've been able to train about 9,000 of our members here in the last 5 months, which is good, but certainly recognizable and most important for today's discussion. The training classes, no matter how contemporary, how ambitious, or how good they are certainly not antidotes for the cure.
Today, we must start the process of determining how we, as the most diverse state in the nation, can bring more culturally appropriate services to a population of children, youth, and adults with varied mental and behavioral health needs. Today, we must extend the discussion beyond the latest incident to determine how our communities properly interact with people in mental crisis prior to their moment of crisis. And if their moment of crisis gets beyond their own control, do we have people in place that can intervene with care and compassion and safely de-escalate an incident for the person involved and those interacting with them. Today is about our neighbors, our friends, and relatives who in a moment of mental health crisis deserve the best possible treatment and respect that we can give them, while at the same time preserving public safety for all persons nearby.